Dear colleagues and friends, today is a fantastic event organized by my partners and colleagues. So I'm planning to share with you the latest achievements in the personalized and precision medicine as applicable to reproductive medicine and family planning. Very briefly introductory. You might see that canonical healthcare is becoming increasingly unaffordable, yet it remains ineffective in preventing or effectively treating chronic diseases and thus to secure the health and the reproductive resources of the mankind. At the same time, a growing family needs a doctor, a practitioner who knows, along with the relatives, their children, and cares for the kids like their own ones and keeping them healthy. Several congenital pediatric disorders are known to arise through multifactorial inheritance, such as look at, please. It's just the examples of congenital disorders. Just listing, just main ones. Cleft lip palate association. Clubfoot. Congenital heart diseases. Urinary tract malformation, and lots of the others. Just an example. The link that might exert reliable control over morbidity, mortality, and disabling rates in particular, as well as significantly optimize the cost and efficacy of treatment for those who had already fallen ill and for persons at risk, is defining as personalized and precision medicine. In brief, PPM. As a model of healthcare services of the next step generation is the unique entity demonstrating an integration in fundamental clinical science, bioengineering and translational art, and IT armamentarium, and illustrating application of a variety of different tools at the population, community, and individuals level. Please look at the picture. The strategy proposed would give a genuine opportunity to secure preventive, prophylactic, therapeutic, and rehabilitative measures whose personalization could have a significantly positive influence on demographics. NIH, Bethesda, Maryland, US, while being a strategic center for American and international medical research and practice. This is just an overview of the letter. Has included PPM into a list of the 5 greatest priorities of development of biomedicine and healthcare services in the current century. And have approved on setting up in US an academical clinical research network entitled as Centers of Personalized and Precision Medicine. Look at some examples. Washington, DC. In Buffalo, US. And one of the best one in the world at the Perelman Center for Personalized Medicine in Philadelphia. In this sense, we would really need centers for personalized and precision pediatry and reproductive medicine, designed to bring next generation care to children and their mothers by using advanced technologies to understand the child's unique genetic makeup and other tailored treatments, and to be developing novel diagnostic and predictive tools, as well as newest therapeutic that target specific diseases, improve health, and to strengthen the reproductive resources gifted by the God and nature. Look at some of the latter. One of the best, Englewood Center for Personalized Pediatry in New Jersey. Center for Personalized Pediatric Medicine and Surgery in Florida. Meanwhile, the aim of pediatric and reproductive PPM, for instance, I do believe is to uniquely combine genetic variation with developmental stage and environmental exposure to provide a tailored preventive diagnostic and therapeutic regimen. PPM is thus a new and exciting field with the potential to significantly improve medical care for children and their relatives and young and smart communities. Well, meanwhile, the recently established at Columbia University, the Reproductive Precision Medicine Center, please look at the picture, please. And Atlanta Perimeter, the Personalized Reproductive Medicine, as well as Family Planning, Michael Wagner Center, San Diego, Family Planning Clinic at UW San Diego Medical Center, develops and evaluates new genomic tests, technology, and treatments and translates them into practice or to care. In the near future, as the genes leading to the inborn defects are identified, medical and in utero gene therapies may become possible. The patients represent a wide cross-section of both normal and abnormal human pregnancies, sometimes from the pre-implantation embryos to the end of pregnancy, being based on the pre-implantation genetic diagnosis. The information from those technologies allows individualized counseling and care based on the latest high-tech innovations, including genetic mapping. Look, please, cytogenetic map, physical map, and DNA sequence. Genome profiling via NGS, next generation sequencing. Look, and overall, genetic factors contribute to risk for many common diseases, including reproductive disorders. Meanwhile, FABMS provides information about the woman's potential fertility so she can make informed family planning choices to identify ovulation and track this vital sign of the menstrual or female reproductive cycle and educate the parents of the near future about reproductive health. Look, please. FABMS. Look at the picture, please, to confirm the letters. Well, PPM is a goal of the modern and upgraded healthcare in which diagnostic and treatment decisions are informed by each person's unique clinical, basics, look at the proteomics, genomics, transcriptomics, and related areas. And environmental information, exposomics related one from microbiocenosis. To achieve the implementation of PPM concept into the daily practice, it's necessary to create a new strategy based upon and driven by biomarkers. Please look at the definition of the latter very briefly. Meanwhile, to really understand PPM, we would have to access the armamentarium tools to exploit and practice PPM resources and genomics tools, including biomarkers in particular. In general, three major types of genomic biomarkers are crucial, important, and valuable for PPM-related services: diagnostic, predictive, and prognostic ones, to be used in most of genomic testing platforms to assess the genetic variations. Look, please, it's indicated just at the picture. Meanwhile, the effect of genetic often depends on the development stage of a child and environmental exposure, such as infection or tobacco smoke during a specific stage. And the aim of reproductive PPM is to uniquely combine genetic variations with development stage and environmental exposure to provide a tailored preventive, diagnostic, and therapeutic regimen. Sorry. Genomic biomarker-based testing. Please be careful. Genomic biomarkers of the next step, latest generation. Just briefly look at the picture. Look at the technologies as well. Very briefly, just look around. One moment. Briefly, carrier testing is offered to individuals who have a family history of a genetic disorder and to people in certain ethnic groups with an increased risk of specific genetic conditions. Predictive and pre-symptomatic testing, very attractive. Look. Preconception testing directly for the family planning and the reproductive medicine. Look around the picture, please. Newborn testing to identify genetic disorders which can be treated pre-early of life of the child, including monogenic and orphan diseases. Look at the picture, please, briefly. Prenatal testing to detect changes in a fetus genes or chromosomes before birth to secure the biosafety. Non-invasive prenatal testing, one of the latest, newest one. It's the hugest market today. Pharmacogenetic testing identifies individual differences in how well or badly people respond to particular drugs. Meanwhile, a combination of genomic and phenomic biomarkers are becoming of greatest significance to be translated into the daily PPM-related practice, including reproductive healthcare services. Why? To predict risks of the inborn defects and thus disabling. Fertility specialists already use specific genomic and phenomic biomarkers to help make the right preventive prophylactic of treatment decisions. In this sense, reproductive medicine is at the preliminary stage of discovering and validating genomic, proteomic, and metabolomic biomarkers. Well, who will patients or persons at risk and their physicians trust to store and interpret the clinical data collected, harvested, and mined? Very complicated question. Healthcare IT does all for a potential solution to those barriers. Look at the picture illustrating the latter I have just mentioned. Very complicated picture. As a result, a patient or a person at risk or a pregnant lady becomes a data carrier. Look, 667 terabytes in medium. The clinical research and translational applications into novel therapeutics will have enabled children with previously debilitating and fatal genetic disorders. The causal gene is known for more than 3,500 monogenic and orphan diseases. It's just an example of the latter. This is the market illustrating the genes identified to secure the monitor monogenic diseases. This is the monogenic versus complex multifactorial disorder, the impact of the investigations. But for children who are still developing and have the most to gain, PPM is more than a bumper stickers. On the micro scale, pre-early genetic testing, I mean subclinical one, perhaps routinely someday in newborn, can help guide medical care, targeted therapies and preventive strategies based on a child's genetic makeup. On the macro scale, big data from the larger population becomes a predictive tool, guiding medical decisions that could be life-altering in a still healthy child. PPM-related reproductive medicine has already accomplished a lot, but there is still a long road ahead to truly achieve PPM. There are difficulties in transforming the research results of genetic and biology into clinical applications. PPM might be able to fill this gap between basic research and clinical application to drive reproductive medicine in the right way. To solve that kind of problems, personalized aims and objectives exist at every stage of disease initiation and progression to develop a personalized health plan addressing lifestyle, risk modification, and disease management. And later, personalized health management and wellness program. As you might see from the above mentioned, PPM has drastically changed and is keeping on changing the landscape of healthcare. This approach, I mean PPM mentioned, should be based on postulates which will change the philosophy of family planning, incarnate culture and social mentality. So, just keep you on the way to understand that the grand change and challenge to secure our health and wellness are rooted not in medicine and not even in science. Just imagine yourself where? In the upgraded high-tech culture to secure the next step outcome in the therapeutic future to secure preventive prophylaxis, canonical treatment, and rehabilitation as the newest entity. Thank you so much for your patience and would be much happy to present the next step information in a year or so. Thank you.